Hello, my name is Brianna Berry, and I'm going to be talking about drug-induced lupus erythematosus. So the layout of this presentation is I'm going to be talking to you what is lupus, the causes of this disease, the signs and symptoms to look for, and how to treat it. So what is drug-induced lupus? So according to the U.S. National Library of Medicine, drug-induced lupus erythematosus, also known as DIL, is an autoimmune disorder triggered by a reaction to a medication. So this can be a variety of medications. According to Zamora et al., about 1/3 of patients who are diagnosed with lupus suffer from this subgroup DIL, and that there are found to be over 100 different drugs that contribute to drug-induced lupus. As mentioned previously, there are over 100 different drugs that are known to cause drug-induced lupus, but in this presentation I will be covering a couple of them. So there are different diseases that have medications that are found to promote this type of lupus. So you have your anti-tubercular drugs. These are used to fight tuberculosis. These drugs are also called HRZE, and those are listed below. And then we have drugs that are involved in rheumatoid arthritis. In the picture at the top, you will see that is an x-ray of rheumatoid arthritis, where we're dealing with the joints and how they're inflamed and you cannot move them as well and you feel a lot of pain. And then ankylosing spondylitis, you also find issues with the medications that are used, along with Crohn's disease. So what happens with these different drugs is that patients will take the medication to treat a long-term disease like Crohn's disease or rheumatoid arthritis. And in the beginning, the drug will do really well. It'll do what it's supposed to do by attacking the target antigen. But then we find that around the 3 to 6 month period of taking the medication, the body starts to react to the drug and it starts rapidly attacking the self cells of the patient that are healthy instead of just the target antigens it was initially attacking. And this can cause many different factors that aren't good for the patient and can make them very weak. So Soho et al. Says that the exact process of how these drugs are producing the lupus is unknown, but however, there is a lot of research pointing in the direction that it is dependent on the N-acetylation speed, which is actually the rate at which the patient can actually metabolize the drug. So people who can't metabolize the drugs that are given to them to fight the disease, it'll cause backup and start attacking all these healthy cells instead of just targeting the bad cells. Drug-induced lupus is very individualistic, and that's why it's hard to tell sometimes whenever this autoimmune disease is taking over, because it can look so different in different people, because different medications can have a different effect on the person. However, it is found that older age can play a factor in who is more susceptible of getting DIL. So what are the signs and symptoms? So drug-induced lupus is very closely related to systemic lupus. However, this one comes from taking drugs, and then it initiates from there. And usually these symptoms appear from the 3 to 6 months after taking the medication, and they usually disappear once you stop taking the medication. So some of the symptoms are muscle and joint pain, purpura, which are red and purple patches on the skin, weight loss, flu-like symptoms like fever and fatigue, and then inflammation of the heart and lungs that causes pleuritic chest pain, and then lesions. These are all the symptoms, some of the symptoms found by the Lupus Foundation of America, and that in drug-induced lupus, the symptoms are less severe than what you would see in systemic lupus. It rarely includes things like kidney and skin disease, and your oral ulcers and hair loss, and anything to do with the CNS systems. So on this slide, I wanted to show the two different ways that we can look at drug-induced lupus when we are going to diagnose it. So on the left-hand side, it's more of the physical characteristics that we can see right off the bat. So in here we see the purpura, where it has the red rashes with the purple undertone, and it becomes very hardened and becomes itchy and painful. And then on the right-hand side, we have more on a molecular level. And what we see here is that this is lupus, but is disguised as Crohn's disease. And so how it can almost mask. So that's why I said sometimes it's hard to diagnose because it can sometimes blend in with the disease that you already have. And so it's hard to tell, is this the disease you already have, or is it the medication that you're taking that is making it worse? So the treatments to stop or reduce DIL is discontinuing the drug that is causing the autoimmunity. So if you're taking a drug for rheumatoid arthritis and it is found to be causing lupus, then they will remove the drug that you're taking for rheumatoid arthritis and hope that the symptoms stop. Usually it takes a few weeks in order for them to stop, but sometimes it can last up to several months. For higher manifestations of the drug-induced lupus, it might be suggested to take high levels of corticosteroids in order to reduce the level of your lupus. However, even if you do discontinue the drug that's causing the autoimmunity, you still have the autoantibodies in your system that can stay positive for several months. So Soljo et al. Suggests that that's enough reason to take anti-inflammatories and immunosuppressive therapies in order to stop all those other symptoms that may come with the autoimmunity. Thank you for listening.